Morning, everyone. Morning, Rob.
Morning, Susie.
Thanks for being up here with me. So I'm Susan Rudiger. I'm the co-founder and chief mission officer of the CMT Research Foundation. Thanks for being here to solve the biggest challenges in CMT drug development. You know, as two patients living with this disease, there couldn't be a more urgent need to help us. And we're so grateful that you all have committed your time and careers, many of you, to helping us and our families. So thank you.
Yeah, and I'm Rob Pryor. I'm a patient and CMT researcher. As a patient, I know what it's like to live with CMT and to struggle with it. Decade ago, I dedicated my life to research in CMT when I joined the lab of Ludo Bosch uh, in Leuven, Belgium. During that time, we helped develop uh, and understand complex roles of lipids in the pathology of CMT and develop new stem cell models and evaluate different therapeutic strategies. And one of those was the role of histone deacylase 6 uh, inhibitors in CMT. The understanding and the therapeutic application of these compounds was a key focus for the lab of Ludo. And based on this research, we were actually able to launch the company Augustine Therapeutics, which is now in phase 1 clinical trials with their novel HDAC6 inhibitor compounds.
Thanks for your work. It's awesome. So this is our 5th annual Global Research Convention, if you guys can believe it. And since our founding in 2018, we've been surrounded by people who are changing the vision of the future for people like me and Rob. But to celebrate those visionaries, we created a Pathfinder Award, which is presented in honor of leadership in advancing knowledge, understanding, and treatment options for the patients with CMT. The Pathfinder Award recognizes excellence in scientific advancements, innovative approaches, and transformative breakthroughs that have the potential to significantly impact the lives of people living with CMT. So the 2025 award goes to, go ahead.
The award goes to Ludo van Bosch. Okay, Ludo. uh, Ludo, you demonstrated great resilience for over a decade while facing many doubters and naysayers. The HX story presented first at the PNS in 2011 in a model of CMT2F, then again in 2018 in a model of CMT2D. You proved that there really was something there worth translating to patients. From the understanding of the complex biology of histone deacylase 6 to the even more complex chemistry of HDAC inhibitor compounds and why some are better than others, you realized we need better and safer compounds to translate to chronic illnesses such as CMT. Luckily, you had an incredible institute, VIB, who partnered with you to translate your vision into the stellar company, Augustine Therapeutics.
I remember being at that PNS meeting in 2011 and feeling really excited about it. And then in 2018, Ludo, you're back presenting the same stuff. Why? The funding thing. And I just remember feeling very excited about it. So in 2023, the CMT Research Foundation, we funded the expansion of Ludo's work into CMT1A, and we made the investment in Augustine Therapeutics. So it was so exciting for me at that 2011 PNS meeting, and where were we? The post office in Maryland, right? And then in Baltimore at the 2018, and then in 2023. So in 25, on the heels of the funding from the Research Foundation, Augustine announced that a new raise of $84 million based on that, but for a total of $110 million that Augustine was able to raise to translate Ludo's initial discovery into human trials. You, my friend, have persisted in the face of adversity. You've kept trying, you've kept plowing, and you've done it for the patients because you knew we needed it. And I'm so grateful. Thank you for persisting when people say no, and you keep saying yes. And I challenge everybody in the room, when you hear no's from the CMT community or when you hear no's from the investor community, keep going because the patients need it. And you are a great example being in phase 1 now, hopefully phase 2 very shortly. Thank you. Thanks for your persistence. Want to say anything?
Yeah, we'll take a picture. Hold on. Here
we'll put you in the middle.
Yeah, go. Do that. In the
Yeah,
middle.
sorry.
Yeah. Not used to this, huh?
You're good. Thanks.
Okay, okay, can I have a few words there?
Take these birds away.
This is a surprise. So I wasn't prepared for this. And I can even tell you a week ago, I was not even coming to this meeting. So I don't know what in the end convinced me to come. By the way, I'm very happy to be here, even more now than a few moments ago. I just can only say thank you. Thank you to the CMT community. I'm an ALS researcher by training. And I feel as a newcomer in the field, I felt very, very welcome from the start. I was really helped a lot with whatever I did from the start, the first discoveries that we made, to the establishment of Augustine Therapeutics. And I really hope, and that's also, I think, the promise that I would like to make, that whatever we do in research, whether it is for CMT or for ALS, that it indeed also makes a difference for patients. I don't think that our ambition as a researcher should be to have good papers in good journals. I really think that we should translate what we are doing into something that can help the life of these patients. And that is what I'm doing in my daily life. And I would like to add, because I don't want to take too much credit. It's only thanks to people like Rob, for instance, like people like Constantin van Utrecht-Wiedewalle, who started the whole project, Veronique Benoit, Laurens van Helleputte, and so many more people in the lab that really are doing the hard work. And without them, I would not stand here. So thank you again. Enjoy the meeting. And now I'm going to relax.